Awesome. So once again, thank you guys so much for joining us this morning for our internship project presentation. I think I know everybody on the call. Of course, obviously, I feel confident that I do, that I've invited you to be a part of this. This is an opportunity, excuse me, this is an opportunity for you to give Vivian, our summer intern, some feedback on her project that she's also using for a capstone for her master's degree program. Um, um, Cheyenne Walmsley served as our mentor for Vivian. Cheyenne is a certified genetic counselor, and she is a member of our board of directors here at the EWE Foundation. I am going to turn it over to Cheyenne to facilitate today's presentation, and I will serve in the background until later in the call. So, Cheyenne, I'll turn it over to you.
Thank you, Sarita. And it's wonderful to, I believe I know almost all of you as well, except maybe you, Bailey. So it's nice to meet you. But I just wanted to first and foremost say that it's been an absolute pleasure to work with Vivian, who was our very first student intern for the EWE Foundation internship program. Today's presentation is on not just an overview of health equity, but also the unique struggles that families and individuals face who are affected by rare disease face within the health equity realm. Vivian's worked very hard to put these slides together in sort of a workshop presentation so there is an activity that we'll all share within. And because we are a little late in getting started, I do want to give Vivian the opportunity to complete this in an unrushed manner. She will actually be leading this workshop completely, of course, with me here as support. So without further ado, Vivian, I'll turn it over to you.
Thank you, Cheyenne, and thank you everyone for being here today. I'm super excited to share with you all what me and Cheyenne have been working on over the summer. So as Cheyenne said, my name is Vivian. I'm an MPH student at the University of Pittsburgh. I'm actually getting my MPH in genetics, and so I'm super passionate about genetics and rare diseases. And so this project was right up my alley. I'm also pursuing a certificate in health equity. This topic is something that's really important to me, and especially, having been involved in this space and seeing all the unique struggles of patients and families affected by rare diseases, it's like really inspired me to do this project. So thank you all for being here today. So just to kind of give you an overview of what we're going to be talking about and covering in this workshop, we have some objectives here. So we're going to be starting with just defining some key concepts, including health equity and its significance in the broader healthcare and public health landscape, differentiating health equity from some other terms like equality and disparity, talking about the relationship between health inequities, disparities, and the social determinants of health, describing intersectionality and how it affects power and privilege, talking about the unique challenges faced by patients and families affected by rare diseases, and then finally ending with some goals and strategies for achieving health equity for rare diseases. And so I'm trying something new here. This is called Menti. It's a way that people can kind of submit responses to questions live during the presentation. So if you could join, it's menti.com, and then the code is 1103-5433, and then you can just send in your response. Where are you calling from today? Okay, Boston, very cool. San Antonio, wow, okay. Birmingham. Huntsville, okay, very cool. Yeah, so we'll be having a few of these polls kind of throughout the workshop just to make it a little bit more interactive and engaging for all of you. So yeah, just like having the website and the code lets you like keep up with any other polls as I open them. So, oh wow, okay. Very cool. Thank you everyone for participating. I'm gonna go ahead and move on to the next question. So this question is just to kind of help me understand where everybody is coming from. So, and like what their background is with health equity and rare diseases. And so you can select multiple if multiple applies to you here. But just like let us know kind of what your background is. Are you someone that identifies with rare disease? Are you okay? Healthcare professionals, okay. Very cool. Lots of people from the rare disease advocacy space. That's very cool to see. Okay. Very cool. Thank you all for participating. It's really nice. It also helps me as I'm like talking about some of these topics to see kind of what everyone's like knowledge is and experience in rare diseases. So thank you all. I'm going to go ahead and go on to the next part of the workshop. So this workshop is broken up into 3 sections. The first section is just going to be a broad discussion about health and its determinants. And so before we go into what is health equity, we thought it would be important to first touch on what is health. And so the WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is something that we kind of forget about. I feel like when it comes to health is that we think a lot about like diseases and healthcare problems, but that's not necessarily all health is. And in addition, health is composed of 3 different types from physical, social, and mental. And so it's important that we're, understanding all 3 parts as a holistic take on health. And so then I also want to talk about what is public health. So public health is defined as the science of preventing disease and improving the health of all people in their communities through the organized efforts of society, organizations, and people. And so I want to point out 2 key things here that really differentiate public health from health and medicine and fields like that is that public health has a focus on preventing disease. And so that's something that a lot of these public health efforts focus on is like, how can we detect this early and prevent this from, getting really serious and out of control? And another thing is that this looks at health of larger populations. So it's not like in healthcare where we're looking at maybe an individual, maybe like their family, and then how can we intervene? How can we treat this disease? We're looking at large populations. And so when we're trying to intervene in public health, it's composed of 3 different parts. I'm not going to read like each component here, but the first part is we're going to assess kind of like what is the healthcare issue here and try to understand it better. And then once we have some information about this disease, then we're going to look into developing policies and programs to address some of these issues. And then assurance is just kind of keeping up with the information and making sure that all of our policies and programs in place are still well maintained and that they're representative of our population. And all of these are centered around equity as well. So next, I want to talk about social determinants of health. These are conditions in the environments where people live, study, and work, and affect a wide range of quality of life and health risks and outcomes. And so there are 5 different types of social determinants of health, from economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social community context. So I'm going to break these down a little bit more on our next slide. So the first one, economic stability. The first things that we kind of think about with economic stability is we're looking at employment status and income level. Those really define your ability to, make a living and, be able to cover things that you need to cover. However, some things that are a little bit more variable are expenses. So this can vary a lot between patients and families, especially depending on the disease or other things in your life. It could be like the size of your household, or like extracurricular activities that the kids might be involved in. And then also debt. So debt can be something that's accumulated over time, maybe from school or in between jobs, or it could be something that's inherited from family members who have passed. And so this can also be a huge burden on people that lack economic stability. And the next determinant is education access and quality. And so this covers like a wide range of things within education, but one of the big ones is literacy. So being able to understand information that's being given to you, not just necessarily being able to read, write, but also truly understand the concepts that are being conveyed. Language is a big one, especially for non-native speakers in the US who don't speak English as their first language. There can definitely be significant language barriers there. And sometimes things can also be lost in translation. So this can cause a lot of issues for people accessing healthcare services. And then also something that we maybe don't think about when it comes to education is also early childhood education, especially special education programs for children with special needs. This is something that definitely varies between schools. And so it's something that it varies between schools, and it's something that is really important to ensuring that students with disabilities feel supported in their education. And then also higher education, whether or not someone has a college degree or professional degree or whatnot. The third determinant here is healthcare access and quality. The biggest thing when it comes to accessing healthcare is the cost of care. It can be a huge barrier to people trying to access healthcare services, and also whether or not people have healthcare coverage. And so this can also kind of intersect with employment. Some people's employment do provide benefits, including health insurance, but not everyone has that opportunity. And so healthcare coverage and cost of care is an important challenge of healthcare access. Also, just the availability of providers in someone's area or in a specific specialty. This can be really challenging because some people with more specialized needs might need a more specialized provider, and depending on things like where they live or the kind of condition that they may have, this can be really difficult. Telehealth has really improved some of these challenges with accessing providers, but even then, there are still some things that can be really difficult for people trying to access services and like reach providers in their specialties. And then also ensuring that providers are competent when it comes to providing care. It's something that's like becoming increasingly more important, is just ensuring linguistic and cultural competency. And so there are some health profession schools that are incorporating some of this training into their education, but even then there can still be some gaps in provider education and provider biases here. And then also, of course, just the quality of care overall. And then the fourth determinant here is neighborhood and physical environment. And so one of the big ones here is housing. So depending on like where you live, how stable your housing is, this can be a really big determinant for you. Transportation, being able to get to, you know, your doctor or get to school or all these different things can be really challenging for you. Also just like the safety and crime rates in your neighborhood, this can be a big determinant of health. And then looking at geography and food security can play also a big role in your health. And then finally, social and community context. So this is talking about being able to integrate into your communities, in social spaces, whether or not you have a strong family or social support, being able to engage with the community, and also just different levels of discrimination, whether this is race and ethnicity or some other social factors. And so why do we care about social determinants of health. And what do I mean when I say health outcomes? So the biggest thing when we talk about health outcomes, people kind of think about like, okay, whether or not someone is sick or healthy. And so that's kind of where mortality and morbidity come into place. It's just like whether or not they have a disease, how serious is the disease. But also it's important to think about things like quality of life. And quality of life, something that we often kind of take for granted when it comes to thinking about our own health. And this can vary. This is not just specific to having a health condition or not. While certainly people with certain health conditions can have their quality of life affected negatively, it can also be having things like a burden of debt, having to constantly be working in order to make ends meet. That can impact your quality of life. Also having a unsafe family home or family dynamic, that can also affect your quality of life, and things like that that we might not think about but are certainly important when we're talking about quality of life. And then life expectancy is pretty self-explanatory, just thinking about how different populations with affected by different determinants have different life expectancies. And then healthcare costs and health status. So when we're talking about healthcare costs, it's important to think about how people are paying for healthcare. And so this goes back again into employment, but also whether or not they have insurance, how far maybe they have to drive to get to their healthcare or their doctor, things like that. And then health status. Sometimes it can take a very long time to even get a diagnosis. And so, not without diagnosis, you're just kind of stuck in like a bit of like a limbo. And so that can be really challenging when it comes to managing your health. And then also having functional limitations. And so there's this table here to kind of help guide what are functional limitations. So some of the sensory ones include vision and hearing problems, but also people with these limitations can be impacted with mobility issues, communication issues. And when we say communication, we're not just talking about speech, but also being able to comprehend speech, whether or not they can hold conversations or, respond to questions being asked of them. Cognition is referring to their ability to learn and process thoughts and feelings. It can also impact their memory and things like that. And then finally, self-care. When we're talking about self-care in this context, we're talking about whether or not they're able to take care of themselves physically, mentally, emotionally. How dependent are they on their caretakers and things like that. And so these are all kind of important when we're talking about health outcomes. Like, what does this mean? What does this look like for patients? And so now we're going to transition over to our second section, which is focusing on health equity. So something that I wanted to kind of address pretty off the bat is just the difference between inequality and inequity. This is a pretty common misconception when we're talking about health equity. And so when we're talking about inequality, this just means difference. It means not the same, quite literally. And then inequity adds this justice component. We're talking about this is an unjust difference. And this picture here really demonstrates this difference. So you can see on the left side, right? Everyone is equal. Everyone gets one box to stand on to try to reach this tree. But it's not equitable because people have different heights here. And so not everyone is able to access the fruit on the trees. But if we really want to have equity, it means everyone is able to access the fruits in the trees. And so whether that means that some people need extra boxes or whatever it may be, this is how we achieve equity. And so inequities and health inequities can come from systemic conditions and policies, and also imbalances in political power. And so when we're talking about health equity, the goal is to reduce and eliminate health differences that systematically favor advantaged groups. And so another term I want to define is health disparity. This is another term that people commonly confuse with health inequity. Health disparities, how I would describe it, is that they're very easy to measure and observe. It's very easy to look at two different populations and be like, okay, this population has a higher rate of this disease than another population. But if we want to understand the health inequities, we have to really ask ourselves why. Why are these two populations different, have different rates of disease? And so that's where it gets more interesting, and we can talk about inequities, like the unjust differences here, and we can examine some of these systemic social and economic conditions and better understand how we can prevent some of these conditions to allow everyone to achieve their full potential. So next, I kind of want to talk about intersectionality and how some of these different conditions quite literally intersect. Intersectionality is defined as the intersection of different social identities, and there's a bunch of them listed on the side here in this picture, to create overlapping discrimination and privilege for disadvantaged individuals and groups. And so these different identities can intersect in a lot of different ways. As you can see here, there's a lot of different identities that you can have that can all impact, that can all create these levels of discrimination and privilege. So some examples are housing segregation based on race and ethnicity. This has been a big problem, especially in some urban parts of the US. The income gap between men and women is a ongoing issue, just based on a gender difference here. And then also poor quality of care due to literacy problems or language barriers. This is another problem where we can see intersection causing some discrimination issues. And so before I talk a little bit more about privilege, I wanted to see kind of what everyone's thoughts are and their understanding about privilege. And so if you could take a couple minutes just to respond to this question in Mentee. Innate advantages. Okay. Yes, I like that. That's very true. Taking for granted what you have access to. Very nice. A perceived right to something or someone. Yes, yes. Unearned advantage from belonging to a particular social group. Yes, that's a big one, is unearned. I think that's something that people kind of forget when they're talking about privilege, is that it's something that you don't realize you have or that you didn't do anything to have based on race, social status, etc. Yes. Okay. I'll give a few more seconds for anyone else who wants to respond to this. Okay. Inability to understand advantages and challenges others experience. I don't know if it makes someone like unable to understand them, but they definitely don't have that firsthand experience if they come from a place of privilege. I think there are definitely ways that we can improve understanding for people that have privilege and make them at least aware about some of these differences and issues. But I don't know if I would go so far as to be like inability, but I do like the point made here. All right. Thank you everyone for responding. I'm going to go ahead and move on to talking about privilege. So as a lot of people were saying, it is characterized as the advantages held by a group in power or in a majority due to the oppression of minority groups. And so there are many different types of privileges. I couldn't talk about all of them in this presentation. But one of the big ones that's kind of been a growing concern in the US is white privileges. And so white privileges specifically talking about the advantages held by white people based on their race over non-white people. And so I like this quote here that I have on the side here. White privilege doesn't mean your life hasn't been hard. It just means that the color of your skin isn't one of the things making it harder. And I think that's something that a lot of people that are very quick to defend themselves over white privilege don't realize is that nobody is trying to tell them that their life is not hard. They're just trying to be like, hey, at least the color of your skin is not one of those issues that is making your life more challenging. And sometimes people like don't understand necessarily. So I really like that quote. And this is another one that I also found that I felt like really explains privilege really well. So she says, some people have a hard time recognizing privilege, saying, I work hard, I don't get things handed to me, and I understand that. Here's how I respond. Privilege isn't bonus points for you and your team. It's unfair penalties the other team gets that you don't. And so, yeah, I really like this because it talks about like it's unfair, it's unjust, and it also doesn't like condemn any one person or side. It's just saying like, hey, this is just how it is. So yeah, it's not the presence of perks and benefits, it's the absence of obstacles and barriers. So that's a lot harder for people to notice, and it's hard to people to like recognize and be more aware of. So yeah, they're saying here, if you have a hard time recognizing your privileges, focus on what you don't have to go through and let that fuel your empathy and action. And so I really like this sentiment here. And so this brings me to our activity. So this activity is called the Wheel of Power and Privilege. Let me actually, I'm gonna drop this into the chat here. So then all of you can participate, but essentially the instructions are also on this document, but essentially what it is that there is this wheel here in the middle, and it just shows a lot of different types of social identities where people might face varying levels of power and privilege. And there's also, you'll see there's little stars around the wheel, and you can drag the stars to wherever you fall on each slice of the pie. Let me know if anyone has any issues with this activity, and then we'll go ahead and give people a few minutes to work on this activity. And then we're going to have a little bit of discussion about the activity afterward. All right. Thank you everyone for doing this activity. We're going to go ahead and on to discussion. So some reminders before we go into this discussion. This is a safe space, so hopefully nobody here is going to say anything, please. And also you do not have to feel like you need to share anything that will make you uncomfortable or feel unsafe. So this is just going to be some kind of broad questions. You don't need to tell us kind of where you fall anywhere on this wheel. But yeah, kind of like first questions is just how did you feel before, during, and after the activity? Feel free to unmute and respond to this question, or you can type in the chat and I'll also be looking there. Has anyone done an activity like this one before? Okay. Yeah, it's a pretty cool activity that like I really think is pretty impactful. It's a very nice visual of kind of seeing the different levels of power and privilege, at least for, you know, a select few different types of identities. Obviously, this wheel can't fit all of them, but it's definitely really nice just to kind of see where you might fall, and also just kind of help bring some self-awareness and self-reflection as well. Did anyone learn anything interesting about themselves or just about this concept of power and privilege while they were doing this activity?
I really loved seeing it laid out in this way with the color wheel. I thought it was incredibly helpful to see all the different aspects of privilege, because I feel like when we talk about privilege, we largely talk about the color of our skin. Sometimes we get into like socioeconomic backgrounds, and sometimes gender, but it's like there's so many more facets to it than that. So I thought it was really helpful to see that.
Yeah, no, I'm glad you said that. That's what I really like about this too, is that while certainly, you know, race and gender, like you said, are important issues, it's not the only by far type of power or privilege that somebody can have. And so I really like that, you know, there is a lot of different types reflected in the wheel. Were there any surprises for anybody while doing the activity? Like they just found something like really interesting or just surprising when they were doing this?
I can.
So I don't.
Oh,
I'm
sorry.
sorry. Go ahead.
I was going to
Go ahead,
mention one
Cheyenne.
thing, just like for the idea of the identity behind disability. So I can say personally, or I'm a type 1 diabetic, and I don't usually view myself as having a disability, but technically, right, legally with like the ADA, like diabetes is considered a disability. And I found myself kind of going like, do I say don't have one? Do I have some form of disability? So I think it just kind of goes to show that there's a lot of gray area, I think, also in how some people might identify themselves, and they don't always fall into certain buckets. Like it's not that black and white. So that was one thing I wanted to comment on.
Yeah, no, that's definitely a very good point. This activity really only has like 3 levels for each category, but there are definitely, even within like these 3 levels, there's different varying degrees of where you might fall. And so I'm really glad that you brought that up and shared that. So thank you.
And I was going to say quickly, I was just going to say really, really quickly. I think, I think looking at the wheel, the way that it's presented, it's a lot of what we already think and know. when we think about, and I apologize for the noise, but I think it's a lot of the things that we already think and know when we have these type of conversations. I think it was just really seeing it laid out like this, that really kind of exposes like wow, like I didn't like I knew that, but I've never thought about it from this context. And one of the things that really stood out to me was education. Uh, like when we think about it, we know that creates inequitable um, situations and outcomes and scenarios for people. But to see it displayed in this manner, it just really affirms what we already know to be. I've never seen this before. I have to say I really, really like it. Really, really like how it depicts the reality.
Mhm. Yeah, no, thank you for saying that. You make a lot of good points. Like this is a very nice visual just for showing the wide range of different types of power and privilege and things that we may not think about or maybe may take for granted, even like education, like you said. So yeah, no, thank you all for participating in this. Uh, any last comments before we move on to the next portion of the workshop? Check the chat. Okay. All
I'll
right.
make one final comment.
Mhm.
For me, I actually found the wheel kind of validating. Something I personally struggle with is I have aspects of great privilege, but also ways in which I do not have aspects of great privilege. And I think sometimes I want to put it in this like yes and no, I have privilege or I don't. And so it was nice to see, sort of going back to my original point, like all of the different categories to acknowledge, like, yes, I do have all of these kinds of privilege, but I also am very, or I guess, unprivileged in some other ways, so that it can be both. It can all be true.
Mhm. Mhm. Yeah, no, I love that. It can be like, especially like when there are definitely more things that people can see, like there are definitely types of power and privilege that are much more visible. Like the color of your skin is something that is like very visible, but some things that people might not necessarily see, but are still areas in which you might experience discrimination are still very important and valid. So I'm glad you brought that up. In the interest of time, I'm going to go ahead and move on to the last section. So this section is going to focus on health equity, specifically in the rare disease space. And so before we kind of dive into these inequities, I kind of wanted to see what are some inequities that all of you are aware of or that know exist in our health system today. So we kind of talked about a few of these when we're talking about the determinants of health, but would love to see like if you maybe like if you experienced this or like you've seen this happen within our health system, would love to kind of see what people think. And I believe this is the last poll question. So. Yes, access to care, treatment options. Yes, diagnosis delay. Delays cause unequal access. Money, information access. That's a good one too. A lot of gaps in research and just what we know about rare diseases because they're so rare. All right. Thank you everyone for responding. I'm gonna go ahead and move on to the next part of the workshop. So just wanting to define kind of what is a rare disease. So we understand rare disease in the United States as impacting fewer than 200,000 people. And we recognize more than 10,000 rare diseases affecting about 1 in 10 people, or a collective 30 million people in the US. And so you can see like disease frequency is pretty small, but overall there is a large number of people in the US impacted by rare diseases. Globally, there are some similar definitions. For example, the EU defines rare disease as impacting fewer than 1 in 2,000 people. And worldwide, there are over 300 million people with rare diseases. Yeah, many of you coming from the advocacy space have probably seen this zebra, but when you hear hoofbeat, sometimes it says zebra, and this goes back into some of the issues with also diagnosing rare diseases because it's so rare. So yeah, but collectively common, as you know, we've seen here in these numbers. Some other characteristics about rare diseases is that they are often chronic, progressive, and degenerative, and so they can also result in disability or be frequently life-threatening. 72% of rare diseases are genetic, and 70% of genetic rare diseases start in childhood, which is often where you first start seeing symptoms, but oftentimes diagnosis can come much later. And then also most rare diseases have no cure and very few treatment options, as some of you pointed out, only 5% with FDA approved treatment. So very, very few treatment options here. And another thing, as you all pointed out as well, is just the high cost of care for rare diseases. Rare diseases collectively impact about 30 million people in the United States, but people with rare diseases are paying 3 to 5 times more for medical costs, and yearly medical costs estimate about $400 billion. So it is very, very expensive. So how can we promote health equity for rare diseases? There are 3 different ones that I really want to point out. Social opportunity is just being able to allow people to have a social environment where they can really thrive. And so, especially considering some of these biases that we kind of talked about with the activity, just ensuring that there is also like support for people with rare diseases in their family and social lives. Non-discrimination in education and employment. This is a big one that people face just because of having some kind of disability. People are like, oh, maybe like this is not the right job for you or the right school for you. And that can be really disheartening for people with rare diseases. And then also just being able to access healthcare, social care, and then diagnosis and treatment in a more expedient timeline. And so, by promoting all of these, we can provide opportunities for people to realize their full participation in family, work, and social lives. And so I'm just going to share, this is a quick 2-minute video. Some of the statistics are a little bit outdated, but I really like this video because it talks about kind of why it's so important that we have health equity for diseases and like how it impacts patients and families. And so you'll find some very nice and meaningful family stories in this video.
You would never know that there was something wrong. They had found the NPC, Niemann-Pick type C, a fatal genetic disorder.
They told us that she had hypoplastic left heart. The left side of the heart didn't develop. Essentially, she had half a heart.
We were told that they were 2 of 5 people in the whole United States that have it. They do not produce any leptin.
There are approximately 7,000 rare diseases. 50% of them affect kids.
She will lose all neurological functions. She'll lose the ability to talk. to swallow. She'll lose the ability to walk. It's terrifying.
It's heartbreaking.
It just hit us hard emotionally and kind of scary. You got to leave it up to the doctors to take care of this heart condition.
Not knowing what your child has and going to all the doctor's appointments over and over and over again and not getting anywhere, you want to give up.
While a single rare disease may only affect a handful of people, altogether more than 25 million Americans have a rare disease.
There's no hope without research. There's a lot of really cool things in the works between the trials, and there's gene therapy going on that looks really promising.
Not only gives new answers in terms of specific diagnosis to kids, but also creates the information base that we need to develop therapies for these diseases, most of which don't have any existing treatments for.
Knowing the answer really helped. Makes it a lot easier to explain to people. Makes it a lot easier for school. Makes it a lot easier on my mental health and other stuff.
Our biggest hope is that the science is quicker than the disease progression. She would not be getting the treatment she's getting now if the research wasn't done 10 years ago, 20 years ago. I always like to think too, diabetes, before all that study was done, people were dying from it. And now there's a treatment and it's manageable.
Yeah, I really like this video. I think it has some really nice touching stories from people with rare diseases, and also there is some diversity in this video, which I appreciate. So yeah, so now that we kind of have an understanding about why it's important to have equity for rare diseases, I just want to kind of end with some strategies for advocating for people with rare diseases. And so the first one I have here is education and awareness. And so what this means is that we're raising awareness about rare diseases, both to the public, but also to healthcare and public health professionals who may be working with this population. And this also means bringing awareness to some of these social stigma and discrimination issues faced by people with rare diseases, so we can reduce stereotypes and bias. And then finally, improving the knowledge and understanding of rare diseases by having better educational programs in medical schools and other health profession schools, as well as in healthcare institutions. And so sharing personal stories and experiences can also help kind of increase awareness, but also humanize the experiences of people with rare diseases, as the video just showed. Next is, of course, healthcare services. This is broken up into kind of 3 different sections. The first being early detection and prevention. Advocating for increased awareness and education can really help healthcare professionals in reducing diagnostic delays, and then promoting things like newborn screening programs for early detection so that we can intervene in a timely manner. Access to specialized care. This means ensuring equitable access to specialized healthcare services and providers. And then one way we can do this is by advocating for telehealth options. And then availability of treatment, advocating for the availability and affordability of treatments, including orphan drugs and innovative therapies, as well as also just advocating for research into the development of some of these treatments. Which brings me to research and policy. So this first one is important, promoting data sharing and participation in research so that we can accelerate the development of treatment. And this includes improving and expanding upon diverse representation. Historically, research has not been super diverse. And so it's really important, especially as more and more people are developing some of these conditions, that we are promoting a more diverse representative population. Advocating for policies that protect the rights and interests of people with rare diseases, including disability accommodations, insurance coverage, and funding for research. And then also working with policymakers to establish things like rare disease registries so that we can inform the public health, public health strategies, excuse me. And this is kind of all depicted in this little graphic on the bottom here, covering more people, covering more medical services, and just overall reducing costs for people with rare diseases. And then, of course, we can't not talk about the importance of patient and family support. So this means having family and support networks for people with rare diseases, as well as patient advocacy groups, so that they have some place to go if they need support, education, and resources. Overall, just promoting mental health services and support to manage some of the mental and emotional challenges of having a rare disease, and then also equipping patients and caregivers with knowledge and skills to navigate the healthcare system and participate in healthcare decisions. And so I just want to leave all of you with this. Health equity for diseases is a multifaceted approach that involves healthcare professionals, researchers, policymakers, patient advocacy groups, and the broader community. And so by addressing some of these considerations, it is possible to improve the quality of life and outcomes for individuals with rare diseases. And we actually at the EWE Foundation have some resources for people with rare diseases. LEAP is focused on providing educational resources for people with rare diseases. Zebra offers mental health and support. There's actually a very brand new peer-to-peer support coaching group for people that need some additional support there. And then Stripe is the financial assistance program offered by the EWE Foundation. And yep, this is me. If you want to contact me after this workshop, this is my email here. I can also put it in the chat. And then this is the EWE Foundation's website where you can learn more about them and some of their resources and programs. Thank you everyone for participating in this workshop today. As Sarita mentioned at the beginning of this workshop is part of my essay project for my master's degree. And so any feedback that you provide in this workshop evaluation form will be really helpful for me in kind of assessing the workshop and how it did and how it performed overall. And then also optionally on the side here, you can scan this QR code to access some resources that I compiled for health equity and rare disease.
Great job, Vivian and Cheyenne. Thank you so much for that. I know we are right at 12 o'clock and I originally scheduled this. So if you have to jump off, I completely understand. But I did want to go ahead and create an opportunity for anybody to give some immediate feedback if you had it.
I think you did an excellent job. I think it was incredibly clear. I appreciated the different sort of sections that you laid out. So it wasn't all just like definition, definition, definition. And I felt those definitions were incredibly helpful because they're not always something that we put words to, like what is health? So I think that's really valuable and you made it engaging. It's pretty. So I think you did excellent.
Oh, thank you so much. I really appreciate that. This is my first time doing this workshop. So all of you are
It's great.
first time attendees. But thank you so much.
I agree. It was very engaging. The use of Minty was really good and trying to keep people engaged throughout the entire thing. The activity with the wheel was really good. So I agree. You did a great job.
Thank you. Thank you so much.
So I'm just gonna say really, really quickly before I let y'all go. I love how you incorporated the interactive polls. I thought that was phenomenal. To be able to access that in real time, I thought that was great. I love how you gave that general overview of the social determinants of health. I think a lot of times we talk about that, but to really have it like right in front of you with that breakdown, I thought was amazing. And the impact of it on just health outcomes, I thought was great. I loved how you created that intersection between health equity and the social determinants of health, but also how you created the intersection between equity and rare diseases. As a rare disease advocacy organization, of course, that's important to us. And I did want to also say that the Health Equity Community Workshop was an idea that the EB Foundation wanted to host. And Vivian's experience in and health equity was a great opportunity for us to try to grow this into a program. And so her working with Cheyenne has been phenomenal for us, and we just really, really appreciate all of that work. I did want to also turn it back over to Cheyenne as her mentor to give any feedback, and she can actually give us that, those final thoughts and wrap ups. And also Kareem, our VP of Operations, if he had anything, I wanted to make sure to recognize him.
Yeah, no. Oh, sorry, Kareem, were you gonna say something?
Nope, go ahead.
Okay.
I was gonna say, go ahead, Cheyenne.
Yeah, no. So Vivian really did just such an amazing job, and she really put this whole thing together. I just helped kind of work to expand on some of the thoughts that she already put in place. I don't know if there's a lot more comments I can make that everyone else hasn't already said, but Vivian, I hope that you feel appreciated with the amount of work that you put into this, and I hope you feel justified is not the right word. Feel good about the feedback that you're getting with this. I think that this is a great baseline for future workshops that the EWE Foundation wants to, host in the future. And also, I'm really looking forward to collaborating on working on this as part of your larger capstone as well. So yeah. And I'll think about providing some more specific feedback also in the specific evaluation form as well.
Okay, thank you so much. Thank you everyone for all your great feedback and for attending today.
Kareem, did you have something really quickly before we let everybody go?
Mel, as Cheyenne just mentioned, I can't say anything outside of what everybody else has said. Outstanding job, Vivian. I could not tell this was your first time. So that was great. It was awesome.
Thank you so much.
Awesome. Well, Vivian and Cheyenne, I will follow up with you guys. I would love to take this presentation. Our whole hope was to actually take this to the community, starting with our local community. That was the whole goal of this project. And so we do intend to do that and take that out there and create an actual workshop to deliver. And so we'll follow up with you after that. But if nobody has anything else, thank you so much for joining. I appreciate you guys being here. Vivian, if you want to send me the links to the form, if everybody wasn't able to capture it with the QR code,
yes,
I can
put it in the
that
chat
out.
also.
Okay, perfect. If y'all get that, I'm also happy to email it out to everybody who's here. Thank y'all again for being here. I appreciate it. Thank you, Vivian.
Thank you.
All right, y'all have a good rest of your day. Thanks so much.
Thank you.
Thanks.
Bye-bye.